So this is my week 1 update for the stimulant medication Mydayis, and I am on 12.5 milligrams. And prior to this, I was on Vyvanse, and it was giving me gastrointestinal issues, lots of heartburn and diarrhea. And as soon as I came off it, the diarrhea and all of that stopped. So I'm pretty sure it was the Vyvanse that was causing the issues. And then I think I was off stimulant medication for about 2 days before I started on the Vyvanse. I mean, on the Mydayis, which I'm currently taking. And I have to say, I've tried a lot of different like non-stimulant medication over the years. I've tried Strattera, I've tried Wellbutrin, I've also tried Zoloft for depression. And I don't typically have a hard time weaning myself off of the medication, but with the stimulant medication, it's a lot harder. So those 2 days that I was off the Vyvanse, I was in a super low and down mood, super depressed. I didn't have any energy to do anything, which really sucked because that was the week of my graduation from my university. That's when I got my bachelor's degree, and it was also the day of my birthday. So I was not in a very good or sociable mood because uh, coming off the stimulant, which was the Vyvanse, just like that, cold turkey was really doing a number on me. And just know that uh, depending on the person, switching medications and coming off it is not always easy. It does take some time, and you might, in between medications, be experiencing really low moods and just a fair warning out there. Um, it was really difficult. So then I started on. I came off the Vyvanse, and then I started on 12.5 milligrams of Mydayis, which is the stimulant medication, which, like I said, I don't think it's as well known as any of the other ones. But uh, I also started about a week ago on 5 milligrams of Trintellix, which I've been on in the past for depression. So I'm trying that again because, like I said, I have been in a really kind of low and depressed mood, but I do feel like it's getting a little better now. I'm not in my best mood currently, but it's not as bad as it was a couple of weeks ago. So that's what I'm currently taking. The 12.5 my day is for the inattentive ADHD, and the 5 milligrams of Trintellix for the depression. I don't know if it helps with anxiety or not. I don't know for sure, but I'm hoping that it does. And I know that the Trintellix also seems to have some cognitive benefits based on research I've done and based on what my psychiatrist has told me. It should also help improve focus and other like cognitive issues that I may be having because of the depression. So the stimulant together with the Trintellix will hopefully really help me with the whole issue with the focusing and whatnot. Um, so yeah, I was talking about how I got my bachelor's degree a couple of weeks ago, or 2 weeks ago, and I got accepted to the master's degree program, so I got into graduate school, and I will be starting that uh, like the last week of August. And it is a part-time online program, which I think will work best for me because I'm a mom and I also don't drive, so I don't want to have to worry about how I'm going to get to school and, leaving my son at home and all that. But more than that, I think that because it's a very rigorous and intense program, the speech pathology master's or graduate programs that I'm going into, um, they're known for being very rigorous and intense. And since I do have issues with anxiety, depression, and concentration because of my ADHD, I really think that the part time program will help me counterbalance some of that. And hopefully, I won't be so overwhelmed or as overwhelmed as I would be if I went to a like on campus, full-time program, because aside from the classes that I have to take, I also have to do practicums, I have to do clinicals, I have to go to different placements and treat patients and diagnose patients with speech and language disorders and all that. And all of that sounds very nerve-wracking in and of itself, because I have major social anxiety, major imposter syndrome, major low self-esteem, and everything in the book that you can kind of name, I have it. A lot of it has to do with my disability, which I have, which is cerebral palsy. Um, but anyway, I'm hoping that to continue on these two medications for the next couple of months, and I'm hoping that come August I'll be in a better mood and also in a better state mentally, so that I can focus better on my classes. And because for the graduate programs, you can't get anything below a B. You get anything below a B, it's like failing a class and you have to retake it. And I um, don't want to have to do that. So yeah, so that's my medication update for now. 2 weeks on Trintellix and 1 week on Mydayis. I'm starting to feel a little better as far as the depression goes. I can't tell for sure as far as the focus and the inattentiveness and the procrastination. Can't tell for sure yet if it's helping with any of that. But I will be back in about a week.